Well, it's always great to hear about partnerships, and today we're going to learn more about a partnership with Ohio Northern University and Mercy Health St. Rita's. And joining us today, we have Dr. J.J. Sreenan, and he's Mercy Health St. Rita's Director of Graduate Medical Education. And then we have Mike Rush, he's the Director of ONU Healthwise and Pharmacy Residency Programs. And thank you guys for coming today.
Thank you.
Thank you for having us.
Okay, so Mike, let's start with you because we hear about the Mobile Healthwise unit that you guys have. You know, refresh people. How did this get started, and how did you guys get this mobile unit to go out into the community?
Sure. So actually, the mobile clinic is an expansion of our on-campus clinics and our pharmacy. So we started the mobile clinic in response to a community health assessment report that showed that a lot of the area's needs in terms of health management, things like diabetes and heart disease, were routine things that we were screening for in our clinics and our pharmacy. So we got the idea to start the mobile clinic. And I like to think of the mobile clinic as the people and the service. It just happens to utilize a 40-foot RV that's been converted into a care room. So we started off with a Taurus and a trunk of medical supplies, and now we've been blessed to have this state-of-the-art vehicle that we take around. But
yeah, it is a neat vehicle to see, and like we've done stories where you guys have been at, and you know you can see it, and it's really neat. So, Doctor, tell us then how St. Rita's kind of got involved with the unit and thought, you know, this is probably a pretty good idea.
Well, St. Rita's was one of the sponsors of the unit as it went out. Kind of the cool thing that happened, though, is the starting of the residency programs so we could further the services on that van. You know, Mike and his team had been just doing a fantastic job of getting out to the healthcare deserts and getting, you know, meeting and greeting the people that don't make it into his clinic and things. But with the advent of the residency programs here, our internal medicine program in particular have been able to send the residents out with them so they can actually have a more complete evaluation, full evaluation and moving forward, so it goes beyond just the screening for diabetes and heart services, but we're also looking at expanding into the other big area of chronic obstructive pulmonary disease and get some lung diseases included as well in the process.
So, Mike, that must be kind of exciting then to have that expansion and have the students interact with the residency program at the hospital.
Oh, yeah, absolutely. So the two together form, a very comprehensive primary care offering. When you go on the mobile clinic now, you will meet a physician in training and a pharmacist in training, both residents, and you'll be able to have a full appointment like you would in any brick and mortar location, maybe even a little bit better because we can now kind of wrap it around full circle. You've got the physicians who are able to provide, for example, a prescription, and the pharmacists who are able to, provide medication through that prescription. So I think it's a pretty powerful model that we've been able to develop, and we're very pleased to be partnering with Mercy. We couldn't do this without them and their generosity. So
where are you guys hitting the road at next? So do you have a plan? Is there a schedule out there, or does it just depend who asks you where to go?
No, so there's a schedule. If individuals who would like to know more can go to www.onu.edu /Healthwise, and from there they can get more information about the pharmacy, but also see the mobile clinic schedule. Our next stop is actually this Friday at the Lima Public Library. We'll be there in the morning, and anyone's welcome to come out.
All right, Doctor, I assume this also aligns with the mission of St. Rita's and trying to go out beyond your big campus.
Oh, absolutely. I mean, ours is to promote that healing ministry of Christ. And, as we started the residency programs, we were, that was one of the big emphasis of starting them is that, we knew we had a huge shortage of physicians and struggling to get them here. And with the impending shortage of physicians, starting the residency program and then partnering with Ohio Northern really helps us out a lot, getting out to these healthcare deserts and extending that, particularly to the underserved. I mean, that's a big part of our mission. and the sites that the bus has gone to, and then things that we're looking at adding will really expand that mission and really help us fulfill it.
Yeah, exciting partnership and exciting stuff that's happening. Thank you both for joining us today.
Thank you.
Thank you, Holly.
All right, don't go away. Noon Edition continues in a moment.